All right, guys, I'm going to share with you how I recovered from cervical instability, post-concussion syndrome, whiplash, everything along that line, okay? So my name is Isabella. I'm a certified personal trainer. I have been a personal trainer for 5+ years. I've worked with professional athletes. I also train pilots currently. I suffered from all of these diagnoses, right? So one thing I want you guys to leave with after you watch this video is the next steps to take. What can you do right now to start getting better? My mission is to help people recover from chronic, debilitating head and neck symptoms, okay? Whether that is from a head injury, whiplash, multiple hits to the head, long-term strain over time, connective tissue disorders. My mission is to help you recover through rebuilding your body, okay? That is the goal, to help you and encourage you to take the steps to rebuild your body, okay? So, a little background on me. I grew up playing soccer, competitive athlete, okay? I was the type of athlete to drag my siblings to go play with me, staying after practice, shooting in my backyard, just very, very good head on my shoulders, I guess you could say. Extremely disciplined and just a chill person, just a chill girl. I'm just a girl. So this all changed though when I had a slip and fall injury. Okay, so that is what triggered everything. But prior to that, right, I did have multiple concussions, right? So I was diagnosed. I also had lots of hits to the head playing soccer. So that, already made me kind of susceptible to having these chronic symptoms after this big injury or traumatic injury, okay? So back in 2020, I fell and I hit the back of my head on a concrete ledge. Did not know I was gonna happen. So my body didn't prepare for that fall, okay? So that's a big thing. If you're not prepared for a hit, you're most likely or more likely to suffer from an injury because you're not, contracting those muscles before to help mitigate the forces that are actually coming to your body, right? So I thought it was just a concussion at first, right? Went through the concussion protocol. This is during COVID. So the school shut down and I kind of just got swept under the rug, right? And it was very, very hard for me to advocate for myself because I was dealing with so many symptoms. So symptoms such as just super hard time concentrating, brain fog, visual disturbances, bobblehead feeling, neck pain, extremely bad headaches, tension type headaches going around the skull, behind the eye. I'm going to explain more in depth why you're getting these symptoms, okay? Food sensitivities, very bloated, anxiety, paranoia, emotional instability, depression. There was just so many symptoms. I'll put a little thing right here of the symptoms. You guys can screenshot that, okay? And it just kept getting worse. I kept on doing my training to prepare for college soccer because this was during my senior year, going into my freshman year of college to go play soccer on a scholarship, right? So I went off. I still went to go play soccer, but my symptoms just did not get better. So I told my doctor about it, the university's doctors, and he made me sit out. So I had to watch, and my symptoms just kept getting worse and worse and worse. I proceeded to do physical therapy with the physical therapist at the school, and I did not feel any better. So, and at this time, this was my lowest moment. So this is back in 2020, I would say September, October. Lowest moment. I just wanted to end things. It's not that I didn't want to, I just didn't want to be suffering so badly. Every single day it was just in fight or flight, and I just felt like I was just constantly shaking, super irritable, I could not make it stop. Light sensitivity, noise sensitivity, just every single stimuli just triggered me. Every single little thing. So that was so hard to deal with. And if you're anything like me, you know exactly what I'm talking about. So I ended up quitting soccer and I went back home and I finished up my associate's degree. That was so hard. I don't know how I did it, honestly. I don't know how I did it. And I even ended up getting transferring and getting my bachelor's of science in 4 years. How I did it in 4 years, dealing with all the symptoms I had, I don't know. But that is just pure it's just crazy. It's crazy. I look back, I'm like, I don't know how I did that. I was just in fight or flight, just going through the motions. I had to do it. I had to finish. I had to do something, right? So, biggest thing that helped. Okay. So now let me go. I'm back. We're back in 2020. So late 2020, after I finished college, my symptoms after I quit college soccer, symptoms just kept getting worse, right? And then I just ended up bedridden, okay? Stayed in a dark room, 2 pairs of sunglasses, and did not get up. And if I did get up, it was just like, downstairs to the kitchen, and I could just barely do anything. Everything just made me worse. So the first glimpse of hope is whenever I saw the Concussion Fix program by Dr. Cameron Marshall. That was the first glimpse of hope. I joined that, and it was a pathway and a step-by-step guide to help me recover, right? However, I felt like I hit a plateau from that because most of my symptoms I saw were actually musculoskeletal, meaning coming from the neck and posture related, okay? So whenever I had that whiplash injury, boom, right? Mind you, I already had really bad posture, right? So I was already here to begin with before the injury, right? So imagine this, boom, everything tightens up, everything gets into spasm, compresses the nerves, you have muscle atrophy after months, and you just end up in this super hypervigilant state, okay? So this loss of lordosis, being in hyperflexion, is not normal, okay? There is a way to train yourself to be in a more upright position and mitigate forces put on the neck so you can actually feel like you're breathing and getting proper blood flow, adequate blood flow to the brain, and not just feel like your head is just pressurized and you're not getting any blood flow, okay? So one thing I did not do is I did not get any type of regenerative treatment. I, went down the rabbit hole of looking at Dr. Hauser's videos, on craniocervical instability. And then and God bless him, God bless him for trying to help people and stuff. However, I just could not afford what he was actually trying to sell. Then, thankfully, I didn't get it because I don't see a lot of testimonies from it. I'm going to be honest. I just do not. But, again, I could be biased, okay? So I'm more so of the belief that I want to do everything I can to avoid spending thousands of dollars. I got here some way, I can get out some way without spending thousands of dollars. I didn't want to get any invasive treatment. I didn't want to get surgery. I just wanted to do things that made sense. Given my background as a personal trainer, I already knew, I'm like, okay, like there has to be something. I'm in the business of, prevention and exercise interventions. I'm like, I'm passionate about that. How can I use this to get better? So, proceeded to go see all the specialists prior to college and also during college. So concussion specialist, neurologist, optometrist, neurooptometrist, masseuse, psychologists, counselors. The list goes on and on. Oh, many physical therapists. I don't know if I already said that. Chiropractors. Let me think. Yeah. So I actually just took something from each one of them. I'm not going to say none of them helped me. I just didn't see much progress myself. So but I always learned. Every single time I saw someone, I always took something from them, okay? So the biggest thing, now let's get into why the concussion fix program, why I hit a plateau with that, and then what I did after, okay? So with the concussion fix program, it's great for people that don't have any clue what's going on with their health, right? However, I knew, I was like, I already have a pretty good foundation on nutrition, and, you know, sleep hygiene and things like that. I'm like, I know all those things contribute. I get that. I'm doing my best with that. But I'm feeling instability. I cannot actually hold up my head. My head was just jarring when I was walking. There was just no type of stability or structure to hold me up. So what I started doing was starting physical therapy, training the muscles, right? I didn't see much progress from that. No, actually, compared to the other ones, let's say all the other ones I named, physical therapy provided me the most help, okay? However, I hit a plateau again, okay? So I'm like, what is going on? The thing is, with a lot of physical therapists, they don't actually teach you how to get stronger and just more functional and just more stable. Like, you know, as a personal trainer, I'm looking at like, okay, let's get these biceps strong, let's get your back strong, all this stuff. Physical therapists, it's all very like, you know, slow, like, ooh, don't do that, you know? That is good, but like, I needed someone that was, one, gonna push me, but someone who understood, like someone who had lived through it. I'm like, I'm talking to all these specialists, but none of them seem to get what I'm talking about. None of them seem to have, because they haven't lived it, you know? It's like, all these things fit me, except for a few things, what they're saying. I'm like, you guys are still missing this. So what helped me overall? You have to train the muscles. Get back in the gym. If you don't go to the gym, you got to get in the gym, okay? You got to get in the gym. Yes, I know you're super symptomatic. You got to start somewhere. So start off, if you were like me, bedridden, you got to start walking somehow, some way. Me, I was in a neck brace. I stopped using that neck brace because I was advised to, because I was told that my muscles would just continue to atrophy. So I'm glad that I did that, because it forced me to challenge myself, and it felt, you know, uncomfortable. I was like, oh gosh, like I actually had to live with the, you know, the feeling of instability instead of just like basically hiding it, right? So exercises you can start doing at the gym. So one, may not help you where you're at right now, okay? You should definitely consult with someone such as myself before you start going through with stuff. If I don't think I can help you, I will, you know, refer you out. But like, this is something that you need to start taking seriously. You got to start being active. Physical activity is key. Exposure is key, okay? If you are so focused on the neck, in the head, that is okay, but you're missing something. You got to build a foundation for yourself with the core, with the thoracic spine, with the shoulders. You got to get your back strong. You got to get your shoulders stronger. You got to get your core stronger. Focus on balance, proprioception, sensory motor control exercises. Just going straight into weighted flexion and extension, if you have instability, is going to flare you up and most likely not going to make you feel any better. So the goal is to improve your body's stability and biomechanics, meaning the way that your body moves, and improving your stability as well, okay? So rebuild. We have to get out of this like scared fear mindset. Trust me, I was there, and it took me years. I was freaking bedbound, wanting to just end stuff, you know? Well, I hit my lowest point before that, but bedridden, I mean, completely socially isolated, pitch dark room, 2 pairs of sunglasses. Like, it's just like, I was just like protecting myself so much. We have to, and I'm going to be that person to push you. My goal is to encourage you, to push you to take action, okay? Take action, okay? I want to see you get better, and you're not going to get better if you don't do anything, if you just stay in bed all day. And never try anything, right? You have to try something. You have to try something, okay? So that is basically how I got better. I want to go into more specifics. I'll do that in the next video, but you can start looking up those exercises on YouTube and stuff like that. But in the meantime, I created an Instagram called Rebuild with Bella, at Rebuild with Bella. I'll be sharing exercises on there, more about my recovery journey, and just tips, okay? Tips. What worked for me, again, may not work for you, okay? There are levels to this. There are people that have that actually have like full instability of the head and neck. That is different than what I'm talking about. I did have instability, but it wasn't completely dislocated or anything like that, you know? I never had any fractures. I didn't have any spinal cord compression according to my MRI. However, I did have really bad symptoms going down my arm and my leg. Half of my body went numb at one point, thought I was having a stroke. All the stuff, you know. I want to go more in depth in the symptoms, but I want to make this as short as possible. I hope that this encourages you guys. The next steps that you guys should take is, one, talking to someone who has lived it, such as myself, okay? So I'll put a link somewhere. I don't know if I can put a link in this for this video or under it, but you can schedule a call with me, 15 minutes, just a free call, 30 minutes, free call, and we'll discuss your journey, and I will see if we are a good fit, okay? So I'm coming at this as a perspective as a personal trainer, not a medical doctor. My goal is to help you rebuild, improve your function, and improve stability. So that is it, guys. Best of luck, okay? Best of luck. We're in this together. You can get better. I know, you can. I believe in it, and I really want to see you guys succeed. Thank you guys so much. Continue spreading light and take action. Bye.